Hello from the United States and freezing cold Connecticut. If you don't know the US terribly well, we're right between New York City and Boston, where I'm calling from. So, let's see. There we go. All right. So, just by way of brief introduction, my name is Colleen Brunetti. I have been living with pulmonary arterial hypertension for almost 17 years. This is me with my family. The tall kid in red was just about 18 months old when I was diagnosed. And we were very, very blessed to adopt my daughter a little over 11 years ago. And that is my husband, Brett. We were college sweethearts. So this is me and my lovely family. I have been with the same PH specialist since I was diagnosed. Count myself very, very lucky to be a direct beneficiary and recipient of all the interesting research that we just heard about for these many, many years. So I'd like to start with an update from the Pulmonary Hypertension Association in the United States. Our little tagline, "Empowered by Hope," is one of my favorite things. There are many things about pulmonary hypertension, as you know, that are difficult, but we do find our power in the hope that we have and the work that we do together. So, PHA is a little bit unique in that we work both with the general public and with medical professionals. So, we have a tremendous amount of support for patients, caregivers, bereaved family members, allied health, which would be your nurses, your respiratory therapists, maybe your cardiac rehab folks, and then, of course, our wonderful doctors as well. It's been a big year at PHA. After a couple of years of very hard work, we have a wonderful new website, which we hope is a great resource for you all seeking information. Same URL if you've ever visited us before, phhassociation.org. But it should be very user-friendly, very mobile responsive, lots of updated and cleaned up information that you can explore. Things like living with pulmonary hypertension, not just your medication and what you do in the clinic, but the time in between that. So diet, exercise, social supports. Lots of caregiver resources, both for adult caregivers and for pediatric. We have a robust medical education program, and medical professionals can access our continuing education. We also have a certification in pulmonary hypertension for nursing, which is somewhat new. And if you are stateside and you want to get involved, there are a lot of ways to do that. I'll be touching on that in a little bit. But everything from attending to leading support groups to being on our telephone support line to working with our local, state, and national governments to work on healthcare reform and laws that help patients with pulmonary hypertension and also rare and chronic diseases in general. So this is just the shot of our homepage. You're greeted by a nice variety of smiling individuals, and it's very, very easy to navigate. So if you look up at the top, you can learn all about the different types of pulmonary hypertension. Then you have your tips for living with PH, events and resources. As far as events go, we do have our international conference happening in Texas this coming June of 2026, and you'll always have a very robust international platform for you all to network with your friends from around the world, learn what other associations are doing, learn what PHA can do to help support. And so we would absolutely love to welcome you in June. And again, that's getting involved, stuff for PH professionals and ongoing news. One thing that we do have that we're hoping that you all can take a look at is all of the international pulmonary hypertension associations that are around the world. And if you see on here that your location is either missing or needs updating, we would love to hear from you. So when you go and look at the international associations, there will be a little add or update your organization. We'd love to know that you are there and working in your area to help PH patients and to support them and their families. So please do feel free to contact us through that button and let us know what you are up to. Going to give you just a minute to look at this map. There's a lot going on, multiple associations in different areas, but you can see we're covered Canada to Mexico, down to the global south, quite a bit in South America, lots and lots of activity in Europe, a little bit in Africa. And then we've got China, Japan, New Zealand. So again, if you don't see yourself represented there, we just need to know, and you can reach out and we can have you added. All right, one of the projects that I have been working on since it was a brilliant idea from some of our leadership right up through today is our PH Care Centers. And so these are essentially our centers of excellence. I'm very, very proud of this program and really thrilled with the level of care that patients are getting and the research that is coming out of it. So I wanted to share a little bit about that with you today. So our PH Care Centers are there to provide easier access to comprehensive PH care. The word comprehensive refers not just to the pulmonary hypertension care, but also hopefully a holistic team, or at least referrals that can get you into things like nutritional support, mental health support, exercise support. Although it is our heart and lungs that are impacted by pulmonary hypertension, it's our whole body that has to walk around with it. And so it's really important that you're taking care of yourself from head to toe. And so one of the things we look at with care centers is that they have those resources in place for patients to look at outside of their time in clinic. They are also helping people get diagnosed earlier and improving long-term health outcomes. We're working hard to ensure treatments and medications are appropriately used to improve quality of life. You heard quite a few great examples in the last presentation of what that might look like. Unfortunately, when patients are seen outside of a PH care center or not with a pulmonary hypertension care expert, we do find that, medications can be described inappropriately. Patients might not be treated aggressively enough. It's really important that patients see a true expert in PH, and these care centers ensure that those professionals have been highly vetted and designated as such. We are working hard to give people with PH clear, reliable information about their condition and care options, and continue to support a medical community that's very well informed about PH standards of care, and offering more opportunities for patients to participate in PH research. So, with that, part of our comprehensive care center is the PHAR program. So, this is the Pulmonary Hypertension Association Registry. And again, a little map for you to look at. This is something that our care centers can opt into. And when they do, they're able to enroll patients who qualify into the PHAR, into the registry. And this allows us to collect data on treatment, how patients are doing, treatment changes, time to clinical worsening. It's just a huge resource for our researchers and for companies looking to create better and more accessible medications for pulmonary hypertension. So as you can see, the centers that have opted into the PHAR program are spread quite nicely across the United States. And we definitely have a few areas of the US where we would like to maybe see more. But some of those blanks on that map are areas that are very rural and might not have a center or even that many people. Whereas you can see we're very congested on the East Coast and there are a lot of people who live there. So some of that is reflected here. All right, so this is so exciting for me to see because, as I said, being involved with this program from the very, very beginning when it was just kind of a dream, we now have 108 total centers of comprehensive care. So these are generally your very large hospitals. Maybe they're teaching hospitals associated with the university in a major city. These are care centers that see a lot of patients that are involved in clinical trial research, and quite a few other standards. And then we have 26 adult regional clinical programs that have been certified to date. These are smaller centers. Maybe they are not doing transplant, or maybe they do less with patients on IV. or they don't have a staff that's big enough to do real robust research, but they are still offering excellent top of the line clinical care to PH patients. And so they also can be certified as programs within our network. We are very excited to have 11 pediatric comprehensive care centers. As you might know, treatment for pediatrics offers a unique set of challenges. Children are not just tiny adults who can be treated the same way. Most of our medications are not approved for them, so they're either being treated off label or on a more select number of treatments. And then we also have three pediatric RCPs, so a total of 14 centers that are offering absolute top of the line, highly vetted care for our children. Of these PHCCs, 80 of them out of the 108 have opted in to participate in the PHAR, and that has resulted in a number that just makes me so happy to see. We now have over 4,000 patients enrolled in the PH Registry, and that is just a tremendous amount of data that can help improve quality of care, drive research questions, just look at ways to make a much better world for those of us living with pulmonary hypertension. And then here's another chart that I am very excited to look at. So this is courtesy of Kevin Hayen, who is our Vice President of Development at the PH Association. He let me know he was working on this, and I said, hey, can I borrow that, please, for my presentation? This is what's coming up. So you heard already earlier today what tremendous research and results we're having, but we still have a ways to go. We still have patients who are on very complex, very burdensome medications. The drugs that have hit the market in the last couple of years are just tremendous advances, but they don't work for everyone or they're not for every type of pulmonary hypertension. And so while we're in a really great place in this disease state, we're still looking for innovation. So we have identified 10 companies that have something in preclinical trial status. We have four in phase one. We have 18 in phase two, meaning we're getting closer. And then nine in phase three, which is the final phase of clinical trials before FDA approval is a possibility. And so we're very hopeful. Some of these will not make it all the way to the finish line, but some of them most likely will. And in the coming years, to go from preclinical to phase three could take 10 years or more, but in the coming years, we should continue to see some really great innovation in treatment. So I hope that this bar graph is exciting for you to look at like it is for me. The other thing I really like to see on this, so these numbers in blue are group one, kind of the more common form of PAH. Group two and three being more complex to treat and having a lot less treatment. I'm really thrilled to see these green and orange bars starting to go up as we look to offer hope to all PH patients with all sorts of types of PH. So, being mindful that this is a very international audience, I just want to go over quickly some of the barriers to care that we are facing in the United States. Because as wonderful as our progress has been, we certainly have our set of challenges. So, our barriers to care are paying for the medication, navigating our US insurance system, and spending just a very large amount of time on the phone advocating for our right to access care. And it is very burdensome on PH patients here in the States and very, very hard to navigate. So we go at this at two ways. We do a lot of national advocacy. So that's working in Washington, D.C. and contacting our reps who represent us at the federal or the national level. We will be doing a big Hill Day visit. So it's Capitol Hill, a Hill Day visit in March where many of us will go through a training. We'll go in with very specific asks for legislation that we're looking at that we hope will improve the lives of pulmonary hypertension patients. We rarely get to meet with the representatives themselves. They're very, very busy, but they have legislative aides who specialize in healthcare who sit down with us, are always very kind, very receptive. It's something that we can talk about with members who are of all different political takes. and try to move the needle forward on the federal level. That being said, things do not move quickly nationally. Especially for me personally, and I know a lot of us, we also look to make changes at the state level. States are a lot smaller. It's easier to get directly in front of your representatives. A lot of times we are able to move things forward state by state, and then at the national level, the federal government will start to take notice. So, um, as the notes say here, it is easier to leverage change at the state level. That's certainly something I've experienced. I've been able to help pass legislation and serve on a rare disease advisory council for my state, and see real change happen within a year or two instead of 5 or 10 years or one or two presidential administrations. One of the things we really want to focus on is that even when we can change policy, we have to make sure that society and values change with it. So the things that are important to us, like healthcare being a right for everyone, is something that people need to buy in no matter what the law is. And just a little reminder to my American friends that these are representatives who work for us, and we can always see them when they're at their home offices and make appointments, or go to their town halls and get in front of them. They are our employees. We put them there. We can vote them out. And so having an open line of communication with them about what's important to us as voters and as people who live in the areas that they represent is something that I hope everyone considers taking advantage of, and that you can do through the Pulmonary Hypertension Association with a great deal of support. We do have a lot of challenges going on in the US right now. We had major legislation passed called the Big Beautiful Bill. It is impacting insurance coverage in the United States, both Medicare, which is insurance that people get who are older or on disability, and also the cost of medication in the United States, which was also already very expensive, is getting much more expensive. So we are concerned about patients having enough coverage to access their care. Vertical integration and monopolies refers to the larger the companies get and the more things they do in healthcare, the more consolidated power they have, and the less options and leverage that patients have. We do have something called fail first or step therapy that we're looking to address, meaning that these insurance companies can deny a medication or push you towards a medication that is their preference, not your preference or the preference of the medical professional, the doctor who knows and treats you. We have pharmacy benefits managers, that's PBMs. They're kind of the middleman in our insurance system. They negotiate drug prices, but they also pass on potential savings to corporations and not to patients, and get in the way of approval of medications. They are very, very challenging to work with quite often. And that prior authorization means that if your doctor prescribes a medication that they know is best for you, the insurance company can come back and make them do hours of paperwork and appeals trying to get you the medication that your doctor already thinks is best. We are having a lot of challenges with oxygen coverage and reimbursement. Patients, unfortunately, are having a really hard time getting enough oxygen delivered to them that they can be independent and out and about. We are seeing patients ration oxygen, allowing their saturations to go lower than is safe, staying home for 3 or 4 days so they have enough oxygen to take with them to, let's say, their nephew's birthday party. And this really has to do with the way oxygen is paid for and covered, and we need changes in that. And then we do have outside organizations, the Institute for Clinical and Economic Review, ICER, and drug pricing review boards that are chiming in on what a medication is valued at and how maybe it should be covered or not. And their numbers and their outlook don't always meld well with what is best for PH patients and the reality of the cost of care of pulmonary hypertension. And so when they put out their opinions and insurance companies try to take them into account, we sometimes have to work on that so that it is more friendly for patients. So lots and lots to celebrate, lots and lots to work on. We've had a really exciting year in 2025. We're looking forward to continuing our efforts to improve pulmonary hypertension care for patients, not only in the United States, but all over the world in 2026. So I'm going to stop my share there.
Great. Thank you, Colleen.
All
Yeah, a lot
right.
to celebrate indeed. The new website is looking amazing. I just had a quick glance at it while you were talking and shared the link in
Looks
the
great.
chat. So I encourage people to look at that. And we did have a question from Melanie. She's curious to know if you have any idea of if pediatric patients mostly have congenital heart defects associated to PAH. Apart from that category and idiopathic PAH, are there many other diseases among pediatric patients?
That's a great question. I am definitely not an expert in the pediatric area. I see someone responded with what is happening in the Netherlands, 50% due to congenital and 50% PAH, with a small percentage being heritable. I would say we see a mix like that. You'd certainly do hear of a lot of children who have PH due to congenital heart diseases or heart defects. I do not have solid data on that. Sorry.
No problem. Thanks very much. And
Mhm.
no, thank you, Colleen, for your support of the Alliance this year, including doing a great pep talk that's on the Alliance's YouTube channel and in the knowledge sharing platform under the pep talks. You can hear more of Colleen there. And yeah, we just really appreciate all of your support of the Alliance and updating us on what's happening in the United States. Certainly been quite a year of ups and downs.
Indeed.
So yeah, with that,